most common sexually transmitted diseases that can cause cancer in women. There are many sexually transmitted diseases. None of them is your friend. But there are some more than others that can lead to deadly cancer. If you don't know which ones do this, stick around through this video as I take you through the complications of some of these sexually transmitted diseases and those which are most likely, if they're not treated properly, to end up in cancer. Hi, welcome back to my channel. I am Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. Here we provide you with information to help you learn more about your body to feel and live better. So if you've been searching YouTube looking for this kind of information, just stop. You have reached the right place. So make sure you go ahead and give this video a like and subscribe to the channel. And please look out for us on social media on Facebook, Instagram and Twitter as @AskAwayHealth. Now, you've all heard about STIs or sexually transmitted infections, and you know they can cause serious illness, whether that's in the short term or immediately and in the long term. A sexually transmitted infection is one that is primarily spread through sexual contact. So that includes vaginal sex, oral and anal sex. For example, they can cause problems with your sex organs. They can lead to problems with your bladder or with urination. And long term, they can cause problems with fertility, affecting both men and women. But what about cancer? So let's review a few sexually transmitted infections and see which ones are linked to cancer. I'm going to start off with chlamydia. Chlamydia is a bacterial sexually transmitted infection. It's often described as the most curable. Like many others, it affects the sex organs, and many times you may not even realize that you have chlamydia because it doesn't show symptoms. So you can imagine how easy it is to spread this particular infection because people don't know that they have it. However, when it causes symptoms, it can lead to things like pain when passing urine, or pain during sex, or a vaginal discharge, or a discharge from the penis. Is there any link with cancer though? We have had a few studies trying to look at whether there is a link between chlamydia and developing cancer later on. Years ago, scientists thought that infection with chlamydia could lead to changes in the tissue or some types of inflammation, which over time can cause cancer. However, we've not been able to prove this conclusively. Now, let's talk about gonorrhea. You don't often get a gonorrhea infection without being aware of it. If you know, you know. From painful sex to burning pain when passing urine or nasty looking discharge from the privates, gonorrhea has lots of different symptoms. In some cases though, there may be no symptoms. Yet, as far as we know, there is no direct link between gonorrhea infection and cancer in future. What about herpes, where you get painful genital sores that's caused by the herpes simplex 2 virus? This too doesn't have yet any clear link with cancer, and neither does another one known as syphilis. Now, syphilis is another nasty sexual infection that causes severe long-term problems when it's left untreated. It affects the brain, the nervous system, the heart, and other organs. Examples of the problem that syphilis can cause include brain or neurological problems, stroke, infection and inflammation of membranes covering the brain and spinal cord, numbness, deafness, visual problems or blindness, changes in personality, dementia, diseases of the valves of the heart, aneurysm, inflammation of blood vessels, paralysis, increased risk of HIV infection, stillbirth, or death of an infant a few days after birth. That's in the case of congenital syphilis. This is a very bad condition, but nowhere on that list does cancer come into the play. We haven't discovered that yet. And there are many other sexually transmitted infections like trichomonas, bacterial vaginosis, mycoplasma, and again, there hasn't been an obvious link with cancer. However, please be careful. These infections, especially when they are not treated or properly treated, can lead to changes in your body's cells that may make you vulnerable to cancer in the long term. For instance, it's been thought that syphilis infection may have been associated with, in some people, with cancer around the anus or of the cervix. Still, Just based off a few cases like that, we cannot say there is a definite link between syphilis and cancer at this point. So I've mentioned a few STIs which, as nasty as they are, do not yet have a definite link with causing cancer or making them more likely to happen. But some others definitely have a link or some relation to causing cancer, which is why you must be extra careful about safe sexual practices. Let's start with the most common, HPV, which is the human papillomavirus infection. Now, hopefully you've heard about HPV because it is implicated in cervical cancer. HPV may be the most common sexually transmitted infection known to man. A study once showed that 3/4 of the people tested had the HPV infection. They didn't realize. And amongst a group of women, if you tested them, 1/4 of them, 25% of them, could have HPV infection at any time. It's also one of those infections that doesn't show any signs if you are infected with HPV, but the virus will stay in the tissues and cause changes that will eventually lead to cancer. And this may not happen for another 10 to 15 years. And this is why vaccines are crucial to preventing HPV infection in the first instance, before there is even a chance for a person to become sexually active and so reduce the risk of developing an infection and passing it on to someone else. In addition, my dear ladies, please get yourself screened for cervical cancer. Don't ignore your cervical cancer screening appointments, and be proactive about arranging them yourself to keep yourself safe. Check out these videos here where I talk about problems that affect the cervix and issues around cervical cancer screening to learn more of this subject. Of course, HPV also causes other types of cancer, such as cancer of the penis, of the vagina and the vulva, the mouth and the anus. Next up is HIV, and we know that until the development of the highly effective antiretroviral drugs, a diagnosis of HIV was linked with severe complications and eventually death. HIV is transmitted in different ways, amongst them including blood and sexual contact. Now, HIV doesn't directly cause cancer, but infection with HIV weakens the immune system. This means that the body is less able to fight off infections which can cause cancer. So what types of cancer are associated with HIV? These are blood cancers like lymphomas or cancer of the cervix, the anus, the liver, the lung or the throat. But the most common cancer complication associated with HIV, which you might have heard about, is Kaposi's sarcoma. This is a cancer that affects the skin, the lymph nodes, and inner lining of parts of the body like the mouth, the nose, and the throat. And the third type of sexual transmitted infection which is associated with cancer is hepatitis. There are many forms of hepatitis spread by various means, including by mouth from eating or from blood or sexual contact. Hepatitis B and hepatitis C are both transmitted through sexual contact, although hepatitis C is less common compared to hepatitis B infection. Both of them eventually can lead to long-term inflammatory scars and changes in the liver, which will finally result in liver cancer. It is because of this risk and the concerns of these complications developing that we have an effective hepatitis B vaccine, as well as quite effective treatments for hepatitis C. So we've discussed the associations between these three sexually transmitted infections and their cancer risk. It's very important that if you do not have a regular sexual partner and you are sexually active, please take steps to protect yourself from both immediate and future risks of complications like some of these we've been talking about in this video. And you might also want to learn how to reduce your risk of developing kidney failure. This is especially as organ trafficking linked to kidney disease is trending in the news at the moment. So check out this video here where I talk about how kidney failure can develop and the steps you can take to reduce your chances of developing kidney failure. Thank you so much for watching. Let me know if you've got any questions around this topic. You can send me a question via our email health information service. I will leave a link for you in the description box below. Remember to give this video a like, drop a comment down below, let me know what you think, and please share with a friend who might find it useful. Do subscribe to the channel and I will see you again soon.